Hey listeners, did you know this episode of med-surg Moments is eligible for CE credit? After you listen to the episode, you may claim 0.5 CE hours by following these easy steps. First, log into the AMSN online library at www.library.amsn.org. Then complete the evaluation for the podcast episode and submit to earn your certificate. The Academy of Medical Surgical Nurses is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. There are no relevant financial relationships with ineligible companies for anyone with the ability to control the content of this episode to disclose. Enjoy the episode.
On this episode of med-surg Moments,
nurses were terrified of taking care of renal patients because they were complicated. So teaching is a very important role when you first meet renal patients to understand their journey. How did they get there? And sometimes they don't really realize it's something as simple as
I know that the doctors have a lot on their plates already, which is why a lot of it does fall on us.
These patients have had careers. They're professionals. They were teachers. They were even nurses or even doctors.
how can we best support already diagnosed renal failure patients during hospitalization in terms of
So we have to find out the root cause of why they're having the frequent admissions in hospitals. And then
a lot of the renal patients I see in the beginning is denial?
if you think about it, these patients' lifestyles have changed completely. You're on outpatient dialysis. A lot of times as nurses, that's how we see those patients. They're dialysis patients, and we don't take.
This is Mary Tess,
Sam,
Eric,
Marcella.
Kelly.
and Sydney. Welcome to med-surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud med-surg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey. Imagine the following scenario. It's 3 p.m. Your post-dialysis patient returns pale and cramping. The lab just flagged critical potassium concerns. Urine output has stalled. What do you do next?
From fluid balance to potassium swings, renal patients can turn fast. And as med-surg nurses, we often find ourselves on the front line of their chronic care.
In this episode, we're discussing med-surg nurses' roles in caring for, teaching, and supporting patients newly facing renal failure during their hospital stay.
We're also going to be talking about non-adherent patients and how we might best help them as well.
With us today to share her experience and wisdom is a familiar voice to med-surg Moments listeners, Linda Brown. You may remember Linda from episode 138, where we celebrated her 40 years of hands-on med-surg nursing experience.
Her excellence in patient-centered care has earned her prestigious recognition, including 4 Daisy Awards and the title of Medical Surgical Nurse of the Year from the March of Dimes.
Throughout her journey, Linda's hallmark has been a deep-rooted passion for making a meaningful difference in the lives of her patients. Linda, it's truly an honor to welcome you to med-surg Moments.
Thank you guys for having me back. It's truly a pleasure to return.
We learned so much about you back in episode 138. And to our listeners, if you missed it, we strongly encourage you to go back and listen. But why don't we begin this episode with what inspired your deep interest in renal patients?
I'll tell you a story. I've been a nurse for 44 years. And back in the 80s, when I was a young nurse, there was always a conversation about renal patients. And nurses were terrified of taking care of renal patients because they were complicated, they were always sick, and it was just really challenging for them. And nurses really did not want to take care of renal patients. Back in 1983, I took a position on a dedicated renal floor, which was also a hemodialysis unit next door. So I became an expert in taking care of renal patients because no one wanted to do it. You never know when an opportunity is going to present itself. And I've always thought that I would be a labor delivery or a surgical nurse, but passion changes, direction changes, and I have been taking care of renal patients for over 35 years.
That's awesome. Talk about the medical surgical nurse's role in teaching and supporting patients diagnosed with renal failure during their hospital stay.
It's interesting that you asked that question because normally we see patients when they're like in the 4th and 5th stages of renal failure. They are blindsided because they can't figure out how things happen. So teaching is a very important role when you first meet renal patients to understand their journey. How did they get there? And sometimes they don't really realize it's something as simple as their blood pressure being uncontrolled and not following up with annual physician's visit, not taking medications or being compliant with that. Dietary restrictions, exercising. So a lot of it is a lack of knowledge that I think that sometimes the medical system don't present to patients, and they take it as a nonchalant diagnosis. And when it's almost too late, then they realize that there are certain things that they could have done to enhance their life. So part of my role as a med-surg nurse with renal patients is teaching them where they are. I meet patients where they are, figure out their lifestyle at home, see what they're doing, and see if we can incorporate better decision-making for them.
Linda, what you said about them not even realizing the severity of what's happening, it did drive me a little crazy sometimes to see that patient that came in a few times before it got to this point of renal failure. I feel like sometimes the doctors are either too busy or afraid to give them the real picture. This is why. It's not just, oh, you're here, you came into the emergency room, now you got to go home with some insulin. Let's say it's related to the consequences of diabetes. Now follow up with someone else. No, it needs to be kind of a heart to heart. This is the road you're on. I know that the doctors have a lot on their plates already, which is why a lot of it does fall on us. But the real picture of what's happening, I agree that sometimes it's not clear to them.
It's not clear. And I think that we talk about in healthcare, individualizing patients' care plans, but sometimes we standardize everything and we assume if we say words to patients, they get it, and they don't. So I find myself using a lot of layman terms, simple terms. I always call it my ABC teaching so that people actually get it and we make sure that they get it. So when they come in, I like to just sit down and talk with them because a lot of times they have careers, and we don't see renal patients as having careers because we normally see them at the final stages where they're on dialysis, their whole lifestyle has changed. But these patients have had careers. They're professionals. They were teachers. They were even nurses or even doctors or moms. And so for them to have this entire lifestyle change, it's a big deal and it's overwhelming. So you have to keep instilling conversations as to what are you doing? Have you tried this? And sometimes I've even had them talk to patients who have been on dialysis who are successful with it.
Linda, I want to say you're so inspirational and I just love your energy. How can we best support already diagnosed renal failure patients during hospitalization in terms of enhancing their quality of life?
As I was saying earlier, when patients come in, there's an issue with something. It could be they're missing a dialysis treatment, and we need to figure out the root cause of why they're missing it. Sometimes it's as simple as the transportation service didn't show up. And then the patients may arrive late and they can't get their full treatment because it's a schedule. Outpatient dialysis centers have schedules and patients have to comply with the schedules if they don't get their full treatment. So a lot of times they end up coming to the hospital that way. That may be a social service issue that we can speak with the social worker to see if we can provide better transportation for that. Sometimes they come in because they're non-compliant with medications. They can't get the prescription filled. So we have to find out the root cause of why they're having the frequent admissions in hospitals, and then to talk with them one-on-one as to ways that they can improve that.
I don't have as much experience with it as you do. A lot of the renal patients I see in the beginning is denial.
It is.
And they don't want to address it. And they think, like everyone else in the world, if I don't look at it, it ain't going to get me. Since you've seen them more down the line, do you feel that they still carry that denial, or does it ever kind of go away and they accept it?
Most patients end up accepting it. You really don't have a choice. I mean, dialysis, you have to get it done. And so the reality of it, we have to tell patients that. And those conversations are not always easy to have. I've stayed in renal patients for so long because I don't have a problem having difficult conversations. I can meet patients where they are. We talk about what is your goal? Because some patients feel like they can do a dialysis once a week and they're okay, but it's not. They lose their spots at the clinic because they're non-compliant with showing up. So we have to figure out what is their goal and find an acceptable form of dialysis that they can do to enhance their lifestyle. It may be peritoneal dialysis.
I didn't realize how efficient those clinics ran. If you're not in that chair, they get you out of that chair.
They get you out of that chair. And then patients get sick while they're at the clinic, so they have to be transported to the hospital for low blood pressures and things like that. I was having this conversation the other day with some colleagues of mine about patients who are on dialysis. And if you think about it, these patients' lifestyles have changed completely. If you're on outpatient dialysis, you have a schedule Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. That same time, that's the rest of your life. Imagine not being able to travel unless you make arrangement with a center in the area where you're traveling, and then having the confidence that that center is going to treat you with the same utmost respect and dignity, and you don't have an issue with the treatment. Some patients have gone to clinics away from home, and they've had problems with their accesses, being stuck the wrong way, it clots off, or they have problems with the catheter, so they're afraid actually to travel. So I think that's one reason why I stayed with renal patients, because of the compassion of them needing someone to keep them in the ball game, to let them know that it's okay and that lifestyle changes can be adjusted. But once patients realize that dialysis is not who they are and that they can incorporate dialysis into their lifestyles, they do so much better. I'm not just a dialysis patient. I have renal disease. I'm on dialysis, but that's not who I am. A lot of times as nurses, that's how we see those patients. They're dialysis patients. And we don't take the time to engage with them and to understand why they have such difficult times meeting all the guidelines for their treatments.
Such a good point. I never thought about that. Travel. One of the things I always come across with them, it's things like blood sugar control and diet. That's so difficult to get them to understand the importance of it.
And you have to also think about what kind of support do they have at home. Some of these patients are not able to cook. They depend on services away from home to bring in meals, and they may not be the healthiest of meals that they can have. And so there are a lot of barriers for patients to be compliant with dialysis. And if they don't have a support system to help them along the way, it can really be a challenging situation. And you'll see frequent hospitalizations because of that.
You do make such a good point too when you say we do see them as dialysis patients, but that's not who they are, but that runs their life. So it's like that balance of they see themselves as that. We need to see the person behind that. It's just so nuanced with everything.
It is. Sometimes you are given a passion or a mission in your life to take care of the underdogs. And I think that's why I pretty much have stayed with renal patients all of these years, because I celebrate them. In doing that, I have conversations that will hopefully inspire them to go to their treatments, do some other things outside of the home. You can go to the park, walk their pets, visit your grandkids, but they have to have a lifestyle besides dialysis. If you think about that, you did it for a year, 3 days a week, dialysis. You spend about 6 hours a day if everything goes well for that. That's like having a part-time job. And sometimes I'll tell patients, this is your part-time job. You have to do this in order for you to be comfortable in life, to be healthy, and to fulfill it as much as you can.
I actually was just reading some work emails today about a pilot program a few units are doing where case managers are boots on the ground on the unit. They want the case managers to meet one-on-one, maybe 10 minutes each nurse, to discuss patients' plan of care. I'm excited about that because, like you said, sometimes it's, they got to talk about with the patient, this isn't working for you. This schedule isn't working for you. What can we change? And as a bedside nurse, things are moving so fast. That's a hard conversation for me to have with someone about planning their lifestyles at home. Like, what can I do? But this idea that I can meet with their case manager who actually can sit down with their social worker and sit down with the doctor, everybody together and come up with a plan. So I'm excited about things like that. And really just the bigger picture for a dialysis patient. It's easy to forget when you're just thinking, you're on your shift and you're like, I got to get these labs. When should I draw them? What's the best time to draw them? They got back from dialysis at this time. Should I draw them now? Should I draw them later? Moments like that, but not big picture stuff sometimes.
And sometimes as nurses, if we put ourselves in the bed, then we do things a little bit differently. And I find that very helpful in the way that I plan my day with patients. We can't solve all of the issues that the dialysis patients have, but we can always find one thing that makes them happy in their lives because they got to do dialysis. That's a no-brainer. But what is one more thing in your life that's important that we can talk about and find a solution or a way that you can still do that and have some fulfillment besides always thinking about dialysis?
Besides the things that we've already talked about, is there anything else that comes to mind that a nurse should think about when they're caring for these patients that are having a tough time?
The different accesses patients have, like the grafts and the fistulas, and a lot of patients are having central lines now because they have access problems. So with the central lines, they're more prone for infection. So these patients, they can't go swimming. There are so many barriers to them succeeding and just finding ways to enhance their life where they can just have a moment of grace. I call it a moment of grace. When patients are non-compliant, there's usually a barrier or underlying reason for that. They don't know how to make the decisions for themselves. So we have to spend the time with them. And it doesn't take but 5 minutes sometimes. Just, hey, how's it going at home? What have you been doing? What do you do on a day you don't go for dialysis? Do you make phone calls? Does anybody come over to see you? Just reiterate the things that are going well for them with their treatment plan. And what are some things that I can help you with or maybe get you help?
So I walked into a patient's room and I had just seen 5 minutes before the doctors put in, oh, she needs another dialysis session today. And she had just asked me and I said, I hadn't seen any orders. So she's like, oh, phew, I'm not going to have to go today. As I walk in, I tell you know what? I just saw the new order. They do think you need another session today. And she just started crying. And I know that some of the symptoms, I'm sure are nausea, exhaustion, dropping blood pressure. When it comes to symptoms like that, what makes them feel better during the dialysis that makes it a little bit less miserable, if you have any tips on that?
Most patients can tell you they don't take their blood pressure medicine if it's once a day. And we have to make sure that we are not pulling too much fluids off patients too. So they have to know what their dry weight is. What is your best weight that when you finish your dialysis treatment, you feel fine afterwards? And sometimes it takes the clinics a minute to get the correlation between the dry weight and the patient feeling well. Every day is a different day. There's no magic to it. We just have to talk with patients, see what's happening with them, what's working, what's not working, and just come up with a plan that way. Some patients never have issues. Some patients are always sick. Some patients eat on dialysis. It just depends. You just have to individualize their care.
My dialysis patients, whenever I receive them back, they're always freezing. So what I started doing is started heating up the rooms before they get back.
Or warm blankets or heat pads, or a warm tea or coffee. It's all about comfort, and sometimes it's more psychological than anything because they're already anticipating feeling bad, or they're already anticipating from the last dialysis treatment, if something went wrong, it may happen again. So just putting them in a spirit of, it's okay, I'm going to do great, and I'll see you when you get back.
Yeah, that's great. Like maybe a journal for what works for them, what hasn't worked for them. Because sometimes I'm looking at their medications. I'm like, what should I give them before dialysis? But now I'm more used to what I shouldn't, blood pressure.
Exactly.
And what else I started doing when I didn't know, I would just call either the doctor, but also the hemodialysis nurses. Exactly. I say, hey, my patient's heading over to you. What do you recommend? Sometimes they have some PRN medications like, oh, yes, please give them this before they come, do this. So communication with the dialysis nurses too has been a big help for me.
And patients can tell you what they need. Sometimes nurses treat dialysis patients as a complicated patient, but it's just like patients with heart failure, liver failure. There are things that we can do to enhance their dialysis treatment. It starts by a basic conversation. You want to brush your teeth before you go for dialysis. So you're changing the mindset. You're making it a more routine thing instead of something that's devastating, especially for patients who are early on in dialysis. It's psychological. It's always enhancing them with, I have the power. I can get through this treatment and it's going to really be okay.
You know what I've always found scary with my dialysis patients? Once in a while, I'll get them and I'll be like, time to go. Let's go to dialysis. They're going to pick you up. And they go, no, I'm not going to do it today. They just flat out refuse because they're tired. They don't want the symptoms. They don't want this. They're having a bad day. Yeah. And you're like, oh, no. I meant you're going to go to dialysis. You're going to dialysis.
You need to go to dialysis. That's right. When you're in the hospital setting, they can change the time to work for them. And so a lot of times if you find out what time works for them, the dialysis team will support that. They're coming over with the stretcher or the wheelchair and get the patient. And the patient absolutely say, I'm not going. But we have to also, as nurses, prepare them. Today is your dialysis treatment. You're going to be leaving at this time. What do we need to do to get you ready for that? So sometimes it's all about just having a conversation and that the expectations that this has to happen. Now, what can we do to make it happen from your standpoint? Dialysis patients are tough. And some days I get it, they just need a day off. And sometimes they just take a day off and they're still okay. But you can't take a day off every week.
Yeah.
And some will take a day off for a week. And they come in and they're in the ICU and they can't understand what happened. So that's when our teaching comes into play again also. The importance of complying with your dialysis treatment. Even on the days that you don't feel great, that's probably why you don't feel great. You need to go for your dialysis treatment.
Yeah. Recently, I saw it with my own eyes. I had a dialysis patient who refused their dialysis, and it didn't take long. It was less than a week, and the patient ended up passing. They said, I'm done with dialysis. I started on Monday. They were ANO times 4. By Wednesday, they had crossed over to comfort care. By Friday, they were gone.
That's one of the decisions that they can make. We have to support their decisions. Dialysis is not for everybody mentally. It takes its toll on you. And when you're alone and you're trying to do all these things and you're trying to go to dialysis, you're trying to maintain, you're trying to pay your bills, it's a lot. When I was a younger nurse, but the older I got, you start thinking about what these patients go through each and every day. If it's not hemodialysis, it's peritoneal dialysis. And that's 4 times a day treatment. These patients are working, trying to work and do exchanges in your office, trying to maintain your job. Companies will work with you for a little while, and then they have to be replaced because they can't do the job.
Yeah, Linda, you talked about sometimes the conversation leads to, oh, what can we change to make this more tolerable for you? But in the scenario that Eric mentioned, sometimes the conversation leads to, well, is there a different plan, goals of care kind of conversation? Is this what you want to continue to do long term? Or do you feel like you don't want to do this anymore? For each patient, treatment options and outlook depends on why they're there for that dialysis. Could you tell me a little bit about how to kind of segue into that conversation when they're kind of, okay, I'm finished. I don't want to do this anymore?
Well, I'll share a story with you. I just had this to happen last week. We had this gentleman in his 70s, and his last option was to start dialysis. And he said that he's thought about that. He's talked with his wife about that for years ago. If that ever came to that decision, he was not going to do it. And so the vascular surgeons came up, nephrology talked with him, his family talked with him, and he elected hospice. And the family supported that. I supported that. He's lived his life. He was sick with COVID, and he almost died with that. And so when this came along, he didn't want to do it again. And so you have to respect that. And immediately they transferred him over to hospice, and within 3 days, he passed away. Those are choices that we can make, and we have to support patients' choices. Give them all of the information, talk them through it, and then in the end, we have to respect the decision that they make.
I know as a new nurse, sometimes it was hard for me to figure out what the outlook was for that patient. Like right away, if I think someone, oh, they're going into renal failure, I'm like, give them a new kidney, please, right now. And it's just not always that scenario, whether it's because they're not a candidate or like this person said, I could live on dialysis and maybe one day get one. But some of them, I've seen that where they come in and they say, you know what? I already know that I don't want to live on dialysis, no matter how short or how long.
Exactly. You think about dialysis, patients have only so many options when they're in renal failure. They have hemodialysis, peritoneal dialysis, transplantation, but you're going to probably be doing hemodialysis and peritoneal dialysis before the transplantation if it happens. And then their last option, they elect not to do anything. Those are their choices. That's it. We wish that we had something else to offer, but once you're on dialysis, unless the transplantation happened, you're going to be on dialysis the rest of your life. So how do you sell that to people and make them feel good about it if they don't have a support system? Now, I've seen patients who have been on dialysis for over 20 years. They got a support system, but there are a lot of patients out there that don't have a support system that can help them get through this. Because we all need support of some kind. And a lot of patients will be non-compliant to come into the hospital setting because their friends are there, people who care about them. They don't have to worry about cooking. Someone's there to help them get cleaned up. They have socialization there. Dialysis patient needs someone who's strong and willing to take the road with them.
Linda, I think you just answered what my next question was, is why do nurses choose to care for renal failure patients?
Someone has to be a cheerleader for dialysis patients. And I realized earlier in my career that that's where I would be. I never imagined that renal would be my purpose in calling and nursing. Sometimes you want one thing and you're chosen to do something else. And so I was chosen to be like this cheerleader for dialysis patients. And it's been fulfilling to me, and it still is. Nursing is always about making a difference. And being a med-surg nurse, it doesn't get any better than this. And I'm just truly blessed that I've been able to see young patients who were lupus patients who became nurses, who had transplantation, who came back and said that they wanted to be a nurse because of how nurses took care of them. So the work that we do is so meaningful and so relevant and so life-changing for people. I still enjoy making a difference each and every day. It's just a blessing just to be a med-surg nurse.
Well, Linda, it's truly been an inspiration having you with us once again on med-surg Moments.
Oh, I love it. Thank you guys for having me, and I appreciate the time.
To our listeners, thanks for joining us. We'll see you next time.
We look forward to connecting with you on the next episode of med-surg Moments, the AMSN podcast. In the meantime, we encourage you to subscribe to med-surg Moments wherever you listen to podcasts.
To reach us, use hashtag med-surg-moments on your social posts.
Or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We are all AMSN members, and if you love med-surg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the med-surg Moments podcast represent the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Eric,
Mary Tess,
Sam,
Calais.
Marcella.
and Sydney. And always remember, med-surg Moments is a moment in our lives and a moment in our med-surg careers that makes a huge difference.